Thank you very much, Anita. You're making me think of the 2000 Surgeon General's report on oral health, which was not a focus on dentistry, it was a focus on oral health. And so the basic sort of major message is everyone is involved in promoting oral health, from individuals at home and families all the way up to any of the healthcare providers within the systems that we have. So speaking about delivery systems, I'm going to turn to Ron to give us his perspective on this first question.
Thank you, Deshanta. Well, my perspective is going to be more from a commercial aspect. I deal with benefit designs and oral health that's delivered to a commercial population. And what the challenges I see is that integration has to go both ways. And in regards to oral health literacy, we've been very strong at saying oral health can help on the medical side. But there's been a resistance from the dentist to actually integrate and take that responsibility back into their own practices. We still have instances too frequently that dentists will refuse to treat a woman who is pregnant for fear of potential liabilities. To me, that is a disservice to those patients. So I think that part of it, in a structure standpoint, let me step back. I'm a part of a system that covers over 75 million lives in this country for dental benefits. We have provided communications in regards to the relationship between oral health and systemic health, but we have not on any large scale been able to push that into our delivery models. Yes, we've changed benefit designs that say you get an extra prophy if you're pregnant, or you get an extra prophy if you're a diabetic, but there's not enough knowledge or information being passed on as to what is the benefit for that. And the challenge really comes down to economics. Dental benefits in this company are driven by the employers and what the employer is willing to pay for their employees. That's one of our biggest challenges. So it's not only the population in general that we have to influence, but it's the decision makers that we have to influence. We have to communicate to those HR directors, to those consultants who make recommendations on what a benefit plan should look like. And that benefit plan should be able to integrate oral health in those areas where it has been shown to be beneficial, to integrate that into the protocols of both the dentist and the physician, so that there's a shared responsibility and also possibly a shared reimbursement that's associated with that. Because one of the biggest pushbacks that I receive from my network of dentists is that, how do I get paid for doing this service? It's not that it's the right thing to do, but it's, will I get paid for it? And if I'm not going to get paid for it, then I'm less likely to do it. That's one of our biggest challenges, is we have to talk about the economics of this integration and where does it fit. Because unfortunately, still in this day and age, the economics are going to drive what services a patient receives and whether or not there's going to be collaboration between physicians and dentists.
That's a big challenge.